everything by prayer and supplication with thanksgiving, let your requests be made known to God, and the peace of God, which surpasses all understanding, will guard your hearts and minds through Christ Jesus. So, I'm a very good worrier. I have it down pretty well, so I admit to that too. So I've had to, especially when you have 4 children, it definitely works its way into your life. But yes.
Do you ever feel like right now we're learning so much about just health and oral cancer and things like that? Do you feel like the more you know, the more you worry?
Oh,
Because
definitely.
I even didn't know. I was like, whatever.
Definitely that is true, and I know, my daughters are one's a nurse and one's, and being pregnant and being older and pregnant, they think about everything that, they know what can go wrong. So it does add a degree for sure. My son works in 8100 and trauma ICU, trauma surgical. Now, he's only 26, but he's seen all the worst things happen, and young people die, and all, changes your perspective. He's changed from wanting a motorcycle to not wanting one. So sometimes there are worries that can change our what we do about it, and that's important. But the things that we can't control, those are the ones that we have to look above and go, okay, I'm going to trust you in this. And I have to say that sometimes, a lot of times.
It is. Like, that's why now I get when people say ignorance is bliss.
Yes.
Because if you don't know, then you won't think
Right.
about it. Yeah.
I agree, 100%. Yes, the more knowledge I gain about, especially about health, that's definitely makes you realize that just so many things can go wrong. The more I study for these classes and recognize the systems, the intricate systems that go, I think, why don't more of us have problems? It's really pretty amazing that a lot of us walk around with minimal problems, or only one thing, so I agree with that. So I'm definitely admit to being pretty good at that worrying part, but I keep working on it. I'm a lot older than you. But, okay, any prayer requests? Of course, this afternoon's SRP comps. Exams, comps, same difference, I guess, but okay. Let's pray then. Our dear Heavenly Father, thank you so much for this class, and thank you for the work they've put into these presentations, and I just pray that each classmate is able to better understand the different disorders and impairments from hearing a personal story, and bless these next 3 classes and what we gain from them. Help it to make us better practitioners and more understanding and capable of empathy, and also knowledge that we can educate our patients and treat them in a better fashion that makes them comfortable and inclusive. And I just pray that you bless each one of these students as they finish out a really busy quarter, and give them health and strength and clear minds to learn what they need to learn, and just guide us through this day. And we just thank you for hearing our prayers and caring about every detail in our lives, and help us to just turn our anxieties and worries over to you. We pray in your name. Amen. Okay, everybody downloaded their quiz who just walked in? Okay. I only had 22 out of 38 downloaded, so that's why I was concerned. And if you forgot you had a quiz today, it's okay, because you didn't have to study for it. So I'm giving you a break. Okay, so this is the I'm getting 38 of your inputs. Okay, is everybody done?
Almost.
Almost, okay. Anybody still need one of these?
We're just gonna bring up our one line.
Yeah, either that or I can bring up your mine. Okay, for those presenting today, if you do not have HDMI, this or this, you either need to get on Gmail, email, or do it through mine. So let me know ahead of time so that we can do this process fairly quickly of changing in between students, okay? Sandra's offered to go first, and then Rachel's offered to go second, and then we're just gonna go in order otherwise, okay? And what you actually are gonna get points for turning this in at the end of class today, so this is important. I don't need you to say how they did on their presentation. I want you to tell me what you learned, something that you really, either maybe you already know, but it was a review and you really want to use that in your treatment of this patient, or something new you learned, something that really interested you about the presentation, okay? Okay, and we need a timekeeper near the front. Anybody want to be a timekeeper? Okay, Sunshine.
Oh,
Okay. So, 5 minutes, and I'm gonna. When does it need battery? Yeah. Okay, the other thing is, close your computers. No need for the computers to be open. And unless you're getting your presentation right up there ready to, or emailing it, but otherwise not. And I will be taking attendance at the end of class to confirm everybody's still here. I gave you 25 points for being here today instead of 5, and that's how it is the next 2 weeks too, so you really don't want to miss class, okay? And I want you here exactly on time next week, even though we don't have a quiz. And to me, this is the most important part of this whole course, is these 3 weeks. So I would appreciate not asking me to be gone for anything less than an absolute emergency, or if you're laying on the floor throwing up, okay? That's about it. You can wear a mask otherwise, and I want you to be here. You can sit in the back, and I want you to be here, even though we're not having a quiz. I know that changes, but you are getting major points for attending. And also, I want you to be really listening to your classmates. And I feel like this is going to help you really understand these disorders better than anything I can say up front. So this is really important to me, and I don't want you guys to miss the next 2 classes just because we don't have a quiz, okay? It really has to be important, above important. You have to, like I said. So, okay, we're gonna go ahead and start with Sandra, and I'm really excited to hear every presentation. Yes. Yeah, I think
Just go like that.
I think that's good. Why don't you give a 1 minute warning.
Okay.
And you can do that if you want, whatever you want.
Vanna White.
Yeah, that works.
I want to just add something. So my presentation is not based on a patient. It's based on a dentist that I shadowed, and he worked with autism. So not everything fits with the same thing.
Okay, the microphone isn't working, so you have to project, and everybody needs to be really quiet in the back. If we're really having problems hearing, then I may go see if we just need a battery, but, let's see if we can do it with just projection and attentiveness. Thank you.
Okay, so my presentation is about autism. Autism is a spectrum, not a disease. So there is no cure for autism, and we say it's a spectrum because it covers other things than autism, and it differs due to their severity. So we have autism, we have Asperger disorder, and pervasive developmental disorder, none otherwise specified. The general physical characteristics and symptoms, you see them, they don't like any emotion, they don't understand the feeling you give them, they don't want to make eye contact, they repeat a phrase or a word repetitively, and they have delayed speech, and they don't respond to their names. And these symptoms can get less if you give them a behavioral treatment. And the oral characteristic, we see them more in boys than girls, like 4 times more. They're due to their dexterity, inability to use hygiene. Like the toothbrush, the toothpaste, they have problem with toothpaste flavors due to their sensory. So you need to change their toothpaste until they get to one they like. They have bruxism, more caries, periodontal disease, gingival hyperplasia due to the medication. And the dentist was telling me he saw different levels. Most of his patients were between age 6 and 12. They're low-income families, so the diagnosis was due to their pediatrician. And some of them, they can't even dress up, they need help to brush their teeth, and even with eating and drinking. And the barriers, the patients we saw, they were coming to a free dental clinic in St. Gabriel, so they didn't have any barriers to the treatment. And he has a mobile clinic, so he goes to their house even if they can't come. And he treats for free, and it's funded by the state. What they want you to know is the autism, they're just children. So you have to talk to them if they are children, and it's just one aspect of their life. It's not a whole character. So they're not awkward people, they're intelligent, some of them are so unique. Respect them, respect their families, talk to them closely, don't talk to them in another room or far away from them. They use your lips to read. They have difficulty understanding words, so they want to see you. They want to see something visually. That's how they understand things. And don't focus on what they can't do, focus on what they can do. For the dental treatment, he was telling me the most important thing is assessment. Assessment is due, it's like the caregiver and the family, they have to do it before they come to the appointment. And it's not just you fill out the papers. You have to show them something related to the visit. Like they're going to the dentist will put a bib on them. So try to tell them, okay, I don't want your clothes to be dirty, and that's why we're putting the bib. So the mom can bring a towel, lay down the child on a couch, and try to put a towel on top, and that will feel like a bib if they go to the dentist. And if problem with brushing using a toothbrush, it means they will have a problem with using the mirror in the dental office. The treatment is on the dentist, and this has to be realistic. If you're doing a prophy, it's different than doing a crown or a filling. So you have to understand what sedation are you gonna give them. Try to not put them on a general sedation because they will not have an idea of what happened in the dentist, like in the visit. So put them on like nitrous, and this will make them remember the visit for the next time. Desensitizing is very important, and you have to show them, tell, show, do, and try to brush your teeth in front of the child. And tell them, okay, I'm brushing my teeth in the morning, I'm brushing my teeth at night, and then ask them, oh, it's morning time, do you want to brush your teeth now? And try to do it with them. This will help them too. Reinforcement, he was telling me the best idea he did was taking a picture for the patient, and this will help them remembering, oh, I was in this chair, I was treated by this patient, doctor, and they keep remembering that. For the instruction, just use visual aid. There is a lot online, and try to do the brushing with them, and change the toothpaste until they like it. Lastly, I enjoyed reading the article, and I understood that it's not only the dentist, it's the whole group work, like the staff, the dentist, the family, the caregiver, and focus on the assessment. It will help the dentist, and don't do general anesthesia. I know some of them will need it, but try to avoid it so they can remember the appointment. Okay, thank you so much. How do we turn off this?
Video mute.
Still there?
Good job. They're all good.
I'll do mine later, trust me. I have like no photos. I just fill in the blanks, mark what we have. In and out.
Just to check to see if I shower.
The good thing about those
I didn't think of that.
But I mean,
Start.
Was everybody able to hear her okay?
Yeah.
Okay. Okay. Hi guys. So I did mine on neurologic disorder, cardiovascular accident. I interviewed my dad. He's sitting right there with my little brother, straight chilling. This is after his stroke. So yeah, he looks pretty good. So ischemic CVA, that's what he experienced, is a sudden loss of brain function due to interference with blood supply to part of the brain. So he had it on the right side. Hypertension is the biggest risk, and he had that before. It happened with him with an embolism. So embolism is the sudden block of a clot of foreign material that is brought to the bloodstream. So he had 2 ischemic strokes within a week. Right afterwards, one of them was smaller, but it was still a full-blown stroke, and then the next one was way bigger. So after the first one, he had left arm weakness and left leg weakness. So he could just tell it was like hard to walk and move. And after the second one, his like left arm just like couldn't move, hand weakness, eye motor weakness, so like peripheral vision, moving his eye was kind of hard. Confusion, like at night, it's like, oh wait a minute, like he knows he's a little confused, so he just kind of has to think about where he's at, type of thing. Heightened emotional response, so he gets, when he's happy, he's like really happy. When he's sad, he's like really sad, or like when he's like scared or something, it's just heightened a little bit more than before. Intensified body pain, so he has like some back issues that are just like more intense since the stroke happened, and his handwriting is not the same as it was before, but he's a doctor, so you can't really tell that it changed up. So he has dysphagia, which is weakness in swallowing, and tongue weakness and loss of sensation on the left side. So it's like a little more, it's different to move his tongue. In swallowing, it's just like, when he starts to swallow, it doesn't really like catch on right away. So that's something to look for in a dental chair, because I didn't know that about stroke victims. I thought it was just, you know, one side type thing. It's just like, that's really important, so suction. So inabilities and abilities to perform ADLs and IADLs. So he has a hard time dressing with buttons and belts. PT and OT really helped him out. So right afterwards, like he couldn't do anything really with his hand and his arm. So like he couldn't put on his shoes. It took him like 45 minutes to put on his clothes. And so with PT and OT, they helped him with brushing his teeth and with dressing and whatnot. He has a hard time flossing his posterior teeth, and and brushing in general is just like less coordinated for him, so he can control it, but not like we can. But PT and OT really helped him out. So he has limited effects now. So if you meet him now, you can hardly tell he had a stroke, which is really good. So he wakes up, he brushes his teeth. Now that I'm in hygiene school, he thinks it's really important. So that's great. He gets dressed on his own. He has a hard time buttoning his shirts, but my mom helps him out with that, and his belt loops. He eats breakfast. My mom makes him breakfast because she's always made him breakfast, actually, so just the way it is. So he works from home now. He used to work in the emergency room, but now he works through online doctor. You know what I mean? Like you can kind of get online, do it through video type thing. So he enjoys that now. So one thing for the dental treatment is neck placement. He's always kind of like careful not to overextend his neck because it can get sore. Epi use, epinephrine, so cardiac dose, and comfort in the dental chair. So he's not like super compromised by his stroke, but some victims are really compromised. So getting there and helping them be comfortable, because they maybe might not be able to move their leg or their arm. So you've got to ask them what you want, what they need you to do, type of thing. So he kind of gave me some medical explanations to some of these questions. So he wanted us to know that each stroke victim is different. That maybe their eyes can't move, you know, and a lot of us don't realize that. I didn't realize that. So you want to sit where they can see you, you know. So yeah, just like the access to the dental chair. Some of them might be in wheelchairs. So you have to keep that in mind, like where am I going to put the wheelchair? How am I going to help them up? Do I need assistance, type of thing. Each one is different. It affects them psychologically, emotionally, physically, and you kind of have to ask, you know, are you afraid of dental treatment? How are you feeling? How can I make you comfortable? Type of thing. And obviously, like what meds they're taking and whatnot. So yeah, a lot of patients are emotionally fragile and might forget about brushing their teeth because their life can just completely change. And but you want to respect them, even though it looks like they can't move or they look very emotional. You know, they still deserve all the respect. So following up with patients really means a lot, and making it really personal to feel like they're important. During treatment, neck placement, cardiac dose, clear for the dental chair, know the side weakness and vision impairments they might have, and you can ask their caregiver or themselves. So interdental brushes are good because it's easier for them to just, it doesn't take a lot of maneuvering around. Floss lengthener, you know those red things in clinic, you put the floss in. And an electric toothbrush. My dad didn't like the vibrations, so it's not really good for him. But so on my journal article, it was about invasive dental care, and it's most likely not a risk factor for ischemic stroke or myocardial infarction. So you can use, I would use this in my practice that if a patient is nervous to get invasive dental care because they're like, oh, I might have a stroke or I might get an MI, well, you can kind of comfort them in that there are studies out there that don't show that invasive dental care leads to an MI or an ischemic stroke. So yeah, that's my dad and Reggie, our cat, supplying pet therapy. So that's it.
You didn't bring my needle? Yeah, I should have thought of that. I didn't realize. I think so, yeah.
That's why you go teach. That's why you go teach Christian.
Yeah, I don't see a USB. AJ, he's when you connect with that with me.
Sunshine catch.
Oh.
There we go. Okay, we're ready.
So my topic is Bell's palsy. Bell's palsy is the paralysis of the facial nerve causing muscular weakness in one side of the face. And I showed you pictures of where that connects in your body, and obviously there's crossovers, so it's only one side affected. This is my sister, all the way on the right-hand side. That's her, and she's also in the middle. That's me and my other two sisters there. This was her before the incident. She is one of the healthiest, strongest people I know. She does CrossFit. She's really into taking care of herself and her body. As far as symptoms go, that led up to her diagnosis. The night prior to it happening, she reported symptoms of shooting, hot, burning pain on the side affected, and a ringing sensation in her ear, but she didn't think anything of it, and she went to sleep and woke up the next morning with that. And her characteristics, like you can see, were just drooping eyes. She wasn't able to close her eyelid, a drooping mouth. She still said she had sensation in her face, but she just wasn't able to move it at all. So I could imagine waking up just knowing that my face was different and I didn't have any control over it. Her most challenging symptoms that affect her daily living is just being able to show facial expression. She'll try to express her face and only one side of her face moves at all, so that's something difficult that she has to deal with, as well as eating food. It's hard to chew on that side. Her cheek muscle doesn't work, so it's hard to keep food on the surface of her mouth on that side, and as well as drinking liquids. I remember her trying to take a sip of water and it just came spewing out because she can't close this side of her mouth. So that was really challenging as far as liquids go. Her symptoms have improved since the first picture that I showed you, but she still experiences some daily pain. She says it feels like she wakes up and it feels like she got punched in her cheekbone. So it's just some soreness on that side, and I believe it's due to no stimulus being provided to that side. The most hard thing she has to deal with is her dry eye, since her eye is not producing any secretions, or she's not able to close it. It just gets really dry and irritated and just restless throughout the day. And I've told her about lubricating eye drops that she wasn't aware of at first. What she wishes the public would understand is that you know, it's something she has to deal with every single day, waking up, knowing that there's nothing she can really do about it. No one can tell her how it started, when it's gonna heal. When she was diagnosed, she was in Japan, so the doctor she saw, she didn't speak their language, and there was just really there's really no help that could be given to her. So she wants people to take it more seriously as far as research goes. She's done her own research and does her own electrostimulus. She puts like muscle stimulators on her cheeks to try and stimulate those muscles, and when she tells the doctors what she's doing to try and take action, they all just are like, don't do that, that's very dangerous, just because Bell's palsy is so uninformed. They don't know how to treat it, so therefore their suggestions to her are really like, just sit there and hope for the best. So she tries to do her best, realizing that this could be her new reality. This is the muscle stimulator that she uses to put on her face. As far as dental treatment goes, it is suggested to use a bite block, but she reports to me that she doesn't have problems opening her mouth, so she can keep it open for quite a while. Never use anesthesia on the opposite side affected, because it's the same as doing both sides of anesthesia. Some aids that you can give patients with Bell's palsy is some biotin rinses to help keep that side of the mouth lubricated, and antibacterial rinses to defend against the bad bacteria that could be growing due to her dry mouth. Some medications that she was prescribed when she was first diagnosed were steroids and antibiotics. And my scientific journal article stated that the best way to combat Bell's palsy is when you take your antibiotic therapy as well as electromuscle stimulus at the same time, has the best results of recovery. And it was my sister that was my reference.
Albert. paraplegia is the paralysis from the waist down, the loss of the lower limbs. I chose paraplegia because my aunt has been affected by paraplegia since 1982. So my Aunt Karen was paralyzed in a car accident while in high school, right before her senior year. And she went through school. She actually went a year in the dental hygiene program and graduated in 1987 with her. As I think she was the first dental hygienist that was paralyzed and got her degree on the West Coast. So the damage is due from a spinal cord injury. So paraplegia is typically caused by a spinal cord injury or a spinal stroke. That is dependent upon where the injury happens. With my aunt, it was right at L2, and they actually had to sever part of the nerve when they did this procedure when she came here. She was also treated here because when you damage the nerve, it's going to inflame and it's going to start pouring out all kinds of inflammatory effects. And so what can actually happen is even if you get damage, let's say at L4, if it's not treated correctly, it can actually travel up and continue traveling, which is why it's important to get treated as soon as possible if you ever have a spinal injury. So it was a car accident. What happened was it was an off-roading accident, and while she was wearing her seatbelt, someone else wasn't. So it's always important to make sure everybody has their seatbelt on in the car. Where my aunt was injured, it was actually possible for her to utilize some of her legs with braces and crutches, but it was just much easier for her to use the chair. So she does have limited leg function. For instance, if she's sitting, she can lift her legs using her hip adductors. And some hamstring function and some knee function. So I didn't put oral characteristics because she's a hygienist and she has complete control of her hands. So like I wanted to tie it into how she was able to do her job. So being in a wheelchair, she had better function of her hands and finer and more and a lot more training in her upper body from constantly moving and being so reliant on her upper body that scaling was pretty easy for her, and she could work a long time without wearing out with fatigue. Because I noticed some people were getting tired on clinic, and I was like, I wonder if it's my hand. Being at chair level, my aunt also would get very much idea about like posture control and training, and so she was really working a lot with that. And so those are two things that I think that I wanted to tie this into us, and so how we can be more efficient, and that's making sure that we are in good patient positioning. So daily abilities or inabilities, my aunt, being paraplegic, was able to do many day-to-day things, cooking, cleaning. You know, they make a lot of cool stuff now. So like, she would dust the top of her furniture with like this big telescoping thing. She also has, from her settlements and stuff, she also got a custom home. So everything is built her level. So countertops are lower, bathrooms are higher, toilets are higher. And that makes things a lot easier. And the only thing she really needs the use of is a catheter. So she knows when she has to use the restroom, but she needs a catheter to do that. So when she was working, she was very active, and she credits a lot of her abilities to of having very understanding dentists. But a lot of dental. When she started working in the 80s, though, a lot of dental offices did not have bathrooms that would work with her, so she would have to wait till lunch to use the restroom. Because a lot of them would have smaller and not handicap accessible bathrooms. Barriers. So while she initially was intended to go to dental school, she pursued in hygiene. She didn't initially reach that it was right for her because as a dentist you have to get up and go to constantly other operatories, and she figured out that wasn't possible. Routine physicals, pain management is a big thing with my aunt, and trips are much more planned. Traveling is also a hard thing with my aunt. Being a dental hygienist for her was awesome. It treated her, she was treated by our counterparts in many different practices she worked in. In some cases you become dependent on others, and this is something that I want people to realize. You can become dependent on others, especially if you have a disability. It's important not to be taken advantage of, and that goes for anybody in any situation. So make sure you're never being taken advantage of. My aunt wants people to know she's not a victim and that she can do things just as anyone else, including being a great dental hygienist. And your support circle makes a big difference for you in your daily life. Know that for when things are not as easy, you can have others to rely upon. And wheelchair transfers was really the only thing that was a big deal for her. And working at a dental office makes access to really key things easier. Outcomes, a lot of people do not mind sharing what happened to them. I was surprised because I never asked my aunt what happened. You know, like you just know something bad happened. And I was surprised that she was willing to share. And so sometimes it's good to ask, like if you see someone with a disability, maybe it's a good thing to ask like what happens. Because then you give them an opportunity to share something about them. And that can lead to better relationships with people. And for me, it's probably better knowing that there are more people who must be more likely to be successful. So we have to do more too, because we see other people doing what they need to do. For what I have, it makes me more grateful for what I have than what I don't have. That's another big thing I want people to realize. So references. No, she can drive. She has hand control. But like traveling's a big deal because, so like let's say she's going on a trip, you don't know like what it's like where you're going, or if you stop at if you stop somewhere pumping gas, it just makes things a lot easier for her. If I'm going with her, I'll do like pulling out the chairs and all that makes it a lot easier for her to do.
Should I wake you up with my vacuum sound? Oh. I wish I could have showed one
Yes.
day.
Okay, so I did my case study on bipolar disorder. I chose this because I have a friend that suffers from bipolar 1 disorder. So, what is bipolar disorder? Bipolar disorder, also known as manic depressive disorder, is a major mood disorder in which episodes of varying degrees of mania and depression occur. These mood ranges from periods of extremely up, elated, and energized behaviors, also known as manic episodes, to very sad, down, or hopeless periods, also known as depressive episodes. When asking my friend about her diagnosis and characteristics and symptoms, she noted that for symptoms, she would not sleep or eat for the weeks leading up to her hospitalization, and she wouldn't brush her teeth or shower for the following 3 days. She was initially misdiagnosed as a paranoid schizophrenic after being picked up from a 5150, and was later re-diagnosed in her outpatient community mental health program as a bipolar 1 disorder with psychotic features. Her inability to sleep and constant racing thoughts were very characteristic of manic episodes and were easily recognized as bipolar disorder once she was released. For oral characteristics and symptoms, she told me that she was in her early stages of periodontal disease, and she experiences sensitivity and bleeding, but not much else. When I asked her about her abilities and inabilities to perform her ADLs and IDLs, she said that she was very capable of performing both ADLs and IDLs. Her and her fiance work together. He has major depressive disorder, so they really work together to keep each other accountable, and they always remind each other to do their ADLs and step in to help with IDLs when one or the other is struggling a bit more than usual. So a day in her life, she would wake up, prepare food for her dogs, take her dogs out, and take her morning meds. Then she would complete her oral hygiene and skincare routine before work, but this would often be missed if she was in a depressive mood, or if she didn't need to leave the house that day. She also suffers from an eating disorder, so she doesn't really eat until the afternoon, and so then later at night when she takes her evening meds, she will try to do her oral hygiene routine at night, but sometimes when her meds kick in, she kind of skips that step as well. For barriers with medical and dental treatment, due to not having health care for 3 years, she became really used to pushing off her dental health care, and even with benefits now, it's hard for her to change that habit, and so sometimes making that appointment is a little bit difficult for her. So this is a bit long, but I really think that what she said was really important for us, so I'm going to read the whole thing. I think that most people suffering from a severe and persisting mental illness feel a good deal of shame on a regular basis, regardless of whether they suffer from an anxiety, mood, or psychotic disorder. We're made to feel guilty for a lot of things we can't control, especially the inability to get out of bed or leave the house. When someone has been in a depressive episode for the last 3 years and finally begins to wake up, their teeth are usually in terrible shape, and it's one more thing to be ashamed of that happened because you were sick. Making that dentist appointment becomes so complicated and scary when thinking about how long it's been since you let anyone look at you in any way, and that you know that your dentist is going to see everything that's wrong with you, or at least with your mouth. I wish dental hygienists and the public would be more aware of how huge a victory it is for a person who has suffered for so long to take just one step towards recovery by making and showing up to a dental appointment. Someone walking in who hasn't had an exam in years should be a VIP, someone to be applauded and congratulated for taking a step towards better health, and not someone to be guilted for neglecting themselves. So for dental treatment, just during appointments, providing encouraging and motivational comments, and possibly pushing their recall appointments to 3 to 4 months instead of 6 months. And for OHI, reminding them of oral health instructions at every appointment is really important, as well as possibly getting them on a chlorhexidine rinse to reduce the severity of their gingivitis. And for my scientific journal article, there was a study done conducted on participants with bipolar disorder and participants that didn't have it. And they found that individuals that did have bipolar disorder were at higher risk for periodontal disease, and those who were in their depressive phases had a higher occurrence of periodontitis and in comparison to those in their mania phase. So these are my references. arthritis. Rheumatoid arthritis is an Rheumatoid arthritis is an autoimmune disease where the body's immune system, which normally protects it, actually attacks itself, and usually in the joints. So my interviewee was diagnosed with rheumatoid arthritis in her mid-30s after experiencing really big flare-ups of inflammation and pain in her joints, usually in her knees and her hips, and they would last months at a time. And to this day, she still experiences these sporadic flare-ups, and she wakes up with really stiff fingers, but throughout the day, the stiffness kind of resolves, at least in the fingers. She doesn't really have any oral symptoms from rheumatoid arthritis. Her activities of daily living are affected when it comes to brushing her teeth and anything that requires dexterity of the fingers, especially in the mornings when her fingers are really stiff and she feels like she can't really bend them or extend them. It makes brushing a little bit harder and flossing, but other than that, she can do pretty average activities during the day. A day in her life, she changed her lifestyle completely after being diagnosed. So she chooses to eat really, really healthy, and she focuses on eating anti-inflammatory foods. She became vegan, and she has noticed a really big difference with this diet change. She lost a lot of weight to give her joints just less of a job, like a lighter load to carry, and she tries to be really active, so she walks 5 miles a day, but she has to be a little bit careful to not do any activities that are high impact, like running or jumping, that could hurt her knees more. And she massages her hands and any of her achy joints with natural oils and actually some CBD ointments that she says makes a really big difference. So far, she hasn't had any medical or dental care barriers. This patient wishes that she's young, but she's experiencing these major joint pains. But a lot of people, she think that maybe she's exaggerating her pain or that she's kind of faking it because she's so young, and they don't understand that someone at that young of an age, like she's in her mid-40s now, could have such bad joints, something that you would commonly see in an older patient. And she also doesn't want to sit down in a dental chair or sit in any medical office and then be treated like she's really old because she's having these symptoms. So one way that we can help out patients with rheumatoid arthritis in our chairs are just making the appointments faster so that they don't have to be in a stiff position for very long. And if they want to stand up and stretch throughout the appointment, they can. And then just some aids to maybe help when their fingers are stiff are using floss holders and a water pick if flossing is still a little too hard to get in there, and electric toothbrushes to reduce the amount of like twisting around with your hands and fingers.
Anything that you learned from your article?
Oh yes, there is a tie between periodontal disease and rheumatoid arthritis because they're both inflammatory diseases, and they come from similar etiologies like cell interactions. I learned. I thought I included this in here, but I guess I didn't. Anyway, yes, that is the tie. there's no definite cause of the Parkinson's disease. It actually imbalance between the dopamine and the acetylcholine receptors. Okay. So for the Parkinson's disease epidemiology, they according to the research the article that I read, and they said they estimate that worldwide they have prevalence of about like 4 to 6 million people get Parkinson's disease, and then they are more likely higher in men. So guys, be careful. Just kidding. And then their average onset age will be 57 years old. So, and then obviously there's unknown etiology. So from the research that I've done, and they found 3 environmental factors that exhibit both consistency and inconsistency depending on the agent. Can you guys we're doing the tobacco cessation this day. Did you know actually sometimes tobacco can helpful for some kind of disease? I was so shocked with this research, but according to this research, smoking is one of the factors that appears have a protective effects on the development of Parkinson's disease. So, but I couldn't ask this patient for, Grandma, why don't you smoke again? I mean, she never smoked, but I cannot, it's not good for patients, so I didn't recommend her. But actually, they don't even know why that it helps giving the good prevent the Parkinson's disease. Biologically, they cannot explain it, but they found a study that it showed that that it kind of helped them to yeah. Anyway, number 2 factors will be pesticides. So they have to wash their vegetables and fruits. Depends if they're exposed to the pesticide, they can get Parkinson's disease. And then for women, whoever has more of estrogen that reduced in women's body, then they will more likely having a Parkinson's disease. So we learned this symptoms. So usually for the Parkinson's disease, they have resting tremors, and then bradykinesia, and then postural instability, and then cognitive dysfunctions, all this non-motor and motor symptoms there. Okay, so for her oral characteristic symptoms, obviously she has left-handed tremors. She has tremors on the left hand, so it's kind of hard. There's not really difficult on her to brushing her teeth with the right hand, but she still has a light tremors on the right hand, so it's going to be hard for her. And then muscle rigidity because it gets stiff. And then she gets, because of the bradykinesia, she might having a hard time speaking or oral care and swallowing. And then she has a dysphagia because of, she couldn't really swallow her stuff. So my patient is a grandma, which is my friend's grandma. And then, so she is right-handed. As I said, she doesn't have any problem with doing the ADL or IADL because she doesn't have any problem with it. Okay, and then she likes to walking more than 30 minutes. When she's walking more than 30 minutes, then she gets difficulty because the muscle stiffness. And then when she's eating or singing, she gets tightened on her muscle. And for the cognitive way, she get late with the responding. So sometimes she forgot my name, if I don't show up to her for a long time, but usually she's good so far. This is her daily life. So she wakes up and gets ready for the day, and then she picks up some fruits and vegetables at her garden and makes breakfast with her husband and for her granddaughter. And after she eats, she goes to the dressing center, so you can meet her. If you go to around this time, she's right there, and taking a class, and then playing ping pong with her husband, and walking for 30 minutes. And after lunch, she's going to physical therapist to get treated. And she prepare dinner and eats dinner, and she go to bed. That's her lifestyle.
got diagnosed early, she doesn't have a lot of symptoms than other people. It depends on their stage. So she doesn't have a lot of medical or dental barriers for now, but maybe for other like Parkinson's disease states, if they have a severe stage for the Parkinson's, they might have it. So according to her, she is also human and someone's mom and wife of her husband. She wants other people to understand Parkinson's disease is progressive, which means change over time. So since her muscles getting stiffened and weakened, she wants health support system is really important. So regular checkup or doctor advice is really important for her. And then depending on her stage of disease, it's very like hard to get enjoyed because her muscle get stiff and it's hard to get enjoyed. But if there is a more activity that they, if there's a more opportunity for getting involved to the activity, fun activity, then she will like to. She can get exercise easily and it'll be better for her life. So based on her interview, we should not recline more than 45 degrees and make sure that because of the dysphagia, and then local anesthesia will be comfort her, and then we have to be aware that she might have fall risk because of movements symptoms. And for her OHI instruction might be electric brush because it's kind of heavy, so they can hold on to it so they don't have tremors going on, and then they can actually, obviously when they're having a manual toothbrush, it's like a basically auto electric brush by themselves, but it's not going to help them anyway, so it's better for them to using the electric brush so it can very easy. So goal of the Parkinson's disease patient would be maintain optimal oral health and wellness to be achieved. Due to their motor and non-motor skills impairment, patient usually getting tremors or all these kind of symptoms. To help the Parkinson's disease patients, dental hygienists have. It would be better to know that they might have oral impact that includes attrition, oral facial pain or discomfort, or TMJ, cracked or biting tongue. So as a dental hygienist, it's crucial to know Parkinson's disease patients, what is Parkinson's disease patients like, and knowing the information about the Parkinson's disease, that will help us to treat them better, help them maintain their optimal oral health. And these are...
That's good.
Okay.
Thank you.
Okay, so my topic was hearing impairment, and for mine it's a little bit different. I did a video. It was 13 minutes long, so I made it. So hearing impairment is the partial or total inability to hear, and it's diagnosed when hearing testing finds that a person is unable to hear 25 decibels in at least one ear. So this is my video. How were you diagnosed? How were you diagnosed with hearing impairment, and what kind of symptoms were you having? How were you diagnosed with a hearing impairment, and what kind of symptoms whenever you have those hearing loss?
I got diagnosed when I was 31, but my father had horrible hearing, so it wasn't a surprise that I might have that.
Okay.
I realized that I was reading lips much more than I was hearing, so that's how I realized. I went and saw an ENT. They did an investigation. I got asked, do you know sign language? I said, yeah, I know it a little bit. The ENT said, that's good, one day you'll need it.
Wow, okay.
So that was how I got diagnosed. But I knew, and I knew that I had a family history along that line.
So it wasn't like anything specific that caused it, it was just like...
No, I mean, I could feel it, going, you know. I once had really, really acute hearing, and then I would be asking people what.
Yeah. Okay, that
And,
makes sense.
and, you know, certain ranges were harder than others. High pitches, really hard.
Okay. Alright, so, what are some, like, existing symptoms and characteristics that you have now?
Oh, now?
Yeah.
Oh, now I'm much worse. I really should get hearing aids, but I haven't yet.
Yeah.
But there was a time where I realized I was relying a lot on reading lips. I had an occasion where I was waiting for a friend in a restaurant, and there were two people seated about 20 feet away from me at a 45-degree angle. And I realized I knew exactly what they were saying in their discussion. It was quite the salacious discussion.
Oh, no.
So then I knew I read lips.
Okay.
And I had a coworker, and he would get up to speak in conferences. He would put his hand like this if he was really thinking. And I realized I wanted to walk up and smack that hand away because he was at the other end of the room.
Oh.
And I had to read his lips.
Wow. That's pretty cool.
And from a dental hygiene standpoint, I'll tell you one of the things that's hard for the lips will be two parts. You guys wear masks, that means you can't read lips. And also muffles sound. But also when we're laying back, you're actually upside down.
Oh, so you can't read them at all.
Right.
Yeah. Okay, that makes sense. Alright, so then, what about, do you have any abilities to perform activities in daily living, such as communicating or an instrumental task, such as using the telephone? Is it harder?
Telephone usually is, at least for me, isn't hard because the amplifiers in any phone, and especially in cell phones, they're pretty good. But I don't ever do it, I don't hold the phone out for me. I always have it to my ear. And it's always this ear because this is, of the two, better ear. And I will orient people to my left so that I can hear them.
Nice. That's pretty cool. Okay, so some things you talked about that were important for us to know is like pulling your mask down when speaking to a patient, and then standing in front of them as opposed to like having them laying down so like they can read your lips because like you said, you can't read lips upside down, so make sure to sit them up. And then sometimes have a clipboard or a piece of paper available for those like who have extreme hearing loss, so maybe they could like write something down. Sorry. this fellows who was saying, and then for my research article, what I found helpful is that it said that inhibiting some molecules actually can protect or even heal one's hearing from noise-induced hearing loss, so I thought that was interesting. And then, yeah, that's pretty much it.
Violence? You messed up. Terrible.
I know it's hard to do it in 5.
Ready for the PowerPoint presentation of the day.
Okay, so my topic is schizophrenia, and I interviewed my friend's mom, who's a psychiatric nurse practitioner. And then I also found out that Levy has a friend who's a schizophrenic too. Okay, so
Can you talk to us a little bit louder?
okay,
Who's Levy?
okay,
Okay, you have a
okay.
be extra quiet.
Okay, so schizophrenia is a psychiatric disorder that affects a lot of aspects of life, such as thought, perception, emotion, and behavior. And then for the general physical characteristics and symptoms, you'll notice that they isolate themselves, that they go into this depressive mode, and schizophrenia is more of like an episodic sort of a psychiatric disorder. So they don't have it like all the time, but they have episodes and remissions. And you'll see that sometimes they'll have PTSD along with schizophrenia, OCD. They'll have like drug disorder or a major depressive disorder, and in order to be diagnosed, you'd have to have 2 or more of the following, which is disorganized speech, or behavior hallucinations, delusions, and negative symptoms. And normally the hallucinations would look like, typically like they'd see dark figures, and like telling them like, hurt yourself, or it's a little scary, but yeah. The sad thing is that they actually don't, like I know I'm sick, but when they have symptoms, like they don't know they're going through it, which is the sad thing. So some oral characteristics that may be seen is periodontal disease is higher among them, and that's typically because of their neglect of just general overall care. Like they would neglect showering, or even like eating, or do laundry, like they just wouldn't, like in episodes. During remissions, it's okay. And then some research that still needs to be studied is that people who suffer from schizophrenia, you might see like a broader hard palate and abnormalities in the teeth. And then some of the abilities and inabilities is again like due to their cognitive issues and negative symptoms, telling them like when they're in the episodes of like being trapped in their mind, and that's telling them like, you're not worth it, like kill yourself and stuff like that. That's when they just can't take care of themselves, and that affects like eating, brushing, flossing, stuff like that. Okay, and a day in their life. So schizophrenia, or people who are affected by schizophrenia, can have a good life if they have a good support system, if they take antipsychotic medications and are compliant. But sometimes it's actually really hard for them to be compliant because of the voices in their head. But the sad thing is that there's no cure, but if they follow up with treatment, like they can have a job. Like my friend's friend who has schizophrenia, like he works at a mechanic shop,
and it's just like certain times that he would have schizophrenia, but like other times he's just a normal person. So barriers that they can have for medical and dental treatment is tardive dyskinesia that we study in class, which is the involuntary movements of like the mouth, the jaws, non-compliance, and basically just like if the team, like the whole dental office team they don't know how to deal with it, that can be also a hindrance to them. So there's a lot here, but the main thing is just not to think that they're crazy, because there's not really a known etiology of why people have schizophrenia. It's very like correlated with like substance abuse, and also like if there's a person in the family who has psychosis. But like they just want to know, they don't want you to think that they're crazy, like where they're going from it. Okay, so for the dental hygiene care plan, so obviously not to treat them when they have an episode, and typically when the medications are controlling their disorder, and to make sure that, like for tardive dyskinesia, to have a mouth prop during the appointment, and then OHI is like normal. Okay, and then what I learned from my scientific journal article is that just to be aware that people diagnosed with schizophrenia have difficulty in swallowing, have some oral ulcers, can have oral candidiasis, and also like a lack of overall hygiene, but that's also like because of their cognitive issues. And then that's my references.
Go Lakers.
Trash Lakers.
Man. Always got a trash on the Lakers.
Alright, so the topic I did was on depression.
Yes.
I'm going to give a quick recap on what it is. Depression is a disturbance marked by apathy, fear, sadness, and loss of mobility and energy. Depression is very common, but it's not always recognized and treated. An estimated 60 million American adults, which is about 7% of the population, have it. It affects all people of all ages, racial, ethnic, and socioeconomic backgrounds. And women are about 70% more likely to experience depression than men. And young adults aged around 18 to 25 years old are 60% more likely to have depression compared to older people. So the friend I interviewed, she was diagnosed on April of this year. She's actually a cop, so she sees a lot of stuff. She goes through a lot of stuff. Prior to her diagnosis, the symptoms that she had was she wasn't eating as much. She was fatigued all the time, a lot of energy, a lot of emotion, a lot of crying, headaches, anxiety. She didn't have a lot of interest in her daily activities. She liked to be in isolation, and she avoided people. When she got diagnosed, her doctor diagnosed her with major depressive disorder, anxiety, and PTSD. Sorry about that. And when I asked her what her current symptoms were, she says it's still isolation. Some days all she wants to do is sleep. Other days she can't sleep. Mood swings, and the main thing is she's always lacking energy. And when she was telling me all these symptoms, I was surprised that it was like pretty much what Miss Hickton's PowerPoint symptoms had, which were depressed mood, decreased pleasure in activities, insomnia, fatigue, decreased concentration, and indecisiveness. So when I asked her if she had any like problem in performing any activities of daily living, she doesn't. She's perfectly fine. The only thing that she doesn't have is motivation. So sometimes when she's not feeling herself, she doesn't floss. But when she's in a okay mood, she'll do everything: brushing, flossing, and applying whitening strips. So on a good day, she'll have a healthy breakfast, she'll gym, run errands, she'll have a healthy lunch, work, play with her dogs. Those are her dogs right there. And on bad days, she pretty much likes to sleep all day. She'll eat unhealthy foods, go back to bed, sleep more, doesn't gym, Netflix in bed, eat more, sleep again, etc., etc. So when I asked her how does she cope with depression, she says she cries it all out. She takes about 15 to 30 minutes of her day and just lets it all out. She reminds herself that it's going to be okay. It's okay to be vulnerable. And after she does her crying, she feels better, in a better mood. She also likes to exercise. She takes melatonin when needed to sleep. And only on like cases where she's feeling like she's isolating herself too much from the world, that's when she goes to therapy. So she has no barriers for medical and dental treatment. Her only barrier is herself. She sometimes doesn't have motivation to seek the help she needs. And I'm pretty sure most of us have seen the movie Joker, and I felt like these pictures were a perfect fit for this topic. I like the picture on the top which says, the worst part of having a mental illness is people expect you to behave as you don't. So when I asked her what she wished the public could understand to make her life easier, was to be patient with them. Depression is not a joke. Most of the time it's out of the control. She says that if people aren't going to help, it's better to leave them alone. She also wishes that parents knew the symptoms of depression. A lot of us don't know the symptoms of depression. And especially, it could be a big culture thing as well. Like in Hispanic cultures, if you're seen crying, being sad, it's a big sign of weakness. So, like, our culture needs to be more educated. These are some dental modifications that were in Miss Hayton's PowerPoint. And probably the one she wanted to tell the class is she wants the patients to feel like they're in control. That's the big one. And the article that I found online was called the 5 strategies when treating patients with mental disorders. So number 1, be supportive. Like Tiffany was saying, it's already a big win for the patients to be in the dental office. So don't judge the patient for having bad oral hygiene. Every patient is different, so remember they all have to have their own specific care. Stay positive, don't give up on them. Teach them some relaxation techniques, breathing techniques, give them calm music, and know your role as a dental hygienist. Like it's been told many times, most of the time they see the dentist more than they see the physician. So it's important for us to know these symptoms. And that's it.
Alzheimer's disease. And so basically what is Alzheimer's? It is a progressive brain disorder that slowly causes memory loss, disorientation, confusion, and has some signs of dementia. So these are the interviewees. It's my grandma Maria, and then my grandpa, who was the one diagnosed with Alzheimer's, Manuel. So basically, some general symptoms and characteristics. One concern was that he would forget what he was doing. He would repeat the same story or sentences that I wrote. And it's like, my grandma would be like, oh, I just told you like 5 minutes ago, and then he just kind of like repeat it again, so she has to be patient and kind of like go along with it. So after a while, he would forget where the restroom was at, like in his own house, and or what to do with like the food or water in his mouth. And one of the most significant symptoms was when he would start getting agitated easily, which would kind of lead to aggression, something that he would have never done when he was like in his normal state. So basically she sent him to his primary doctor, and after doing some few exams and stuff like that with a neurologist, he was diagnosed in 2011 with it. So basically some oral characteristics is that he has a very hard time swallowing, mostly because he kind of just forgets what to do with the stuff in his mouth. So, like, even if she would like feed him something, like he would just kind of like have it in his mouth for like several minutes actually, and my grandma would be like, oh, do you still have it in your mouth? And then he would just kind of like not say anything, just keep chewing, and my grandma would have to swallow it, and then he kind of would not know what to do, so he would just kind of like spit it out. Same with like liquids and stuff. And so that's why she had to kind of like change his diet to like some soft foods, so kind of look like applesauce, kind of everything like just kind of blended, just so it was kind of easier for him to swallow. And some abilities or inabilities to perform ADL was that when the disease started to progress, he was basically unable to like brush his own teeth, bathe, dress, use the restroom, move from the couch to the bed, or like just because like even when he would try to put a shirt on, he would kind of like forget how to put it on. It would kind of like be backwards. So, and then when the stage started to like progress, he first started off using a walker just so he could feel a little bit more stable. And when it started to progress, he did have a difficult time moving, so he had to be wheelchair bound. So some barriers that he encountered in medical or dental treatment was that basically he just became kind of unaware that he needed to go to the dentist or the doctor's office. It was more like my grandma was like, oh, it's time to go, and then he would kind of be like, why? He was just kind of like out of it. And basically, yeah, it became kind of, when he was wheelchair bound, it became kind of difficult to put him in the cart, mostly because my grandma was doing it all by herself, and so that became kind of a barrier as well. And also, like, he was unable to remember how to do daily actions, so if he was, like I said, asked to swallow, he would kind of not know how to do that. And then during the later stages, he was unable to detect or tell you what he felt. Like, he would kind of complain or kind of cry, and we'd be like, oh, what's wrong? Is something hurting you? And then he'd just kind of like nod yes, and then we'd be like, oh, what's hurting? And he kind of would forget, and like he would just kind of not know. And so what they wish the public would know, so just be very patient with people with Alzheimer's, be prepared to repeat phrases several times, and if the patient gets frustrated, that they don't remember something, don't keep insisting, kind of just keep going along with it. And recognize that they have involuntary actions sometimes, so basically be very patient with them. And something that I learned from the article is don't give up on them. Like, yes, they could be a little difficult, but just, keep positive and keep a positive attitude and be patient with them. And sometimes if you try to like change like some their toothbrush to an electronic one, it's okay to kind of become a little bit scared due to the vibrations or the sounds, but just tell them to keep coming into their appointments every 4 or 6 months. So these are the references, and that's my family.
Brian.
So I will be doing attention deficit hyperactive disorder, or ADHD. Just a quick definition. So it's usually diagnosed in childhood. It's characterized by difficulty in paying attention, excessive activity, acting without regard to consequence, oftentimes interfering with academic, occupational, and social performance. So based on the interview, basically her oral characteristics were normal. However, when it comes to like the IADL and that sort of thing, she doesn't have any kind of trouble brushing her teeth, but she just kind of has to have a list of things that she needs to do, because at times she can feel disorganized and a lot of other things going on in her life, so she doesn't make that a priority for her. So yeah, so she had mentioned she was ADL level 0, meaning it's high ability. So in addition to evaluation of a child with ADHD, there are a lot of other conditions that are commonly coexist with ADHD, such as anxiety, depression, oppositional, defiant, and conduct disorders, which also need to be assessed, and these conditions can be emotional or behavioral. And I have the rest of the interview. Is the volume on?
That would have been in 5th grade. I don't know how many years ago that was. I was diagnosed by someone who gave me a test, and how they diagnosed me was through a series of tests. And I think I forgot the second part of the question. Oh, lack of concentration, and I always wanted to ask a bunch of questions in class, and so I was constantly curious, but the teacher didn't have patience for that. Well, everybody does. Yeah, I guess so. Sometimes attention while other things are going on, like someone's clicking a pencil, or someone's making a bunch of racket, or children are running around and I'm trying to focus on something. It can be a little bit distracting. But for the most part, as an adult, it's gotten much better. Well, I've taken Adderall, and I have recently discovered something called Vyvanse. It's like a new version of Adderall, and that seems to work a lot better for me. Magical. I don't know, is that what everyone wants to say? Well, like most people, I brush my teeth. I try to eat 3 meals a day. Try to enjoy the most out of life when I'm not working my 8-to-5 job. And if I have a little extra time, I like to do a little bit of reading and a little bit of cycling. No. Well, I mean, I'm not dental. That has nothing to do with your, my brain being neurotypical or not. As far as medical care, I guess you could say it was a little bit difficult because I didn't know how to act. Well, I guess if they're trying to give me some sort of instruction, or if they're asking me a bunch of questions, if they were to put me in a room that was a little bit farther away from other noisy children, that would be helpful. But other than that, most of the time I go to adult dental offices, and it's pretty easy to focus in on what I need to be hearing. I can't really think off the top of my head. I guess for children it would be helpful to diagnose to ensure they're on how to floss, learn how to do it as an adult. try and roll with everyone's different ways of working.
Go, Brian.
Thank you.
Okay, we did good. 2 minutes, right there. So thank you very much. That's exactly what I was hoping for. You guys shared a lot of really good information. And yes, I need you to turn in those, papers for today. You will get credit for completing those. And, I'm looking forward to next week. Be on time and, we will have another great week. Thank you. Yeah. Thank you.
Oh, okay, yeah. Okay. Oh, okay. Yeah. Okay. I have to go back to clinic at 1 because I have to get my approval form. Yeah. Let's do that. Yeah. Like in and out. Do you like Korean food? Or Korean food? You want to try the Korean food? It's near Chipotle. Oh. It's like a Korean barbecue.
Like in the opposite side, like
Yeah.
across Panera?
Yeah. I always wanted to see what it's like. Okay.
But you want to go and come back, or you want to wait until you get your things and then?
Oh.
Or do you have to be at 1 or do you have to be for clinic?
Before clinic. There's no time crunch.
I need to upload the video.
What is it?
The video?
Oh, for this one?
Yeah.
Oh, okay. You have to.
I asked you if I could.
As a compressor or?
The regular file, not like a video.
Oh. Yes. Jonathan's on Korean barbecue right now? Yeah. Where? It's actually the same place as Chipotle, but on the side. That's a good question. Yeah. I'll let you know how much I have this year. Oh, yeah? You can buy one single box.
And I'm gonna do this, like, I'll do this. I already told him that, it's like $20. Brian, can you hook me up with the rest? Oh, okay.
Oh, I got you. This year. Yeah, it's just a bunch of presentations, but.
I know, we have to fill it out.
Oh, okay, okay. Got you.
Thank you.
Yeah.
Miss Hayden, I apologize.
Shame.